Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. We'll be speaking with Chad Worz. He's joining us here as Executive Director and Chief Executive Officer of the American Society of Consultant Pharmacists. He's going to talk with us about flu vaccine options for older adults and those with chronic health conditions. Welcome to Health Professional Radio, Chad Worz. Thank you so much for joining us.
Thank you.
Tell us a bit about your background and your role as the President of the American Society of Consultant Pharmacists.
Well, my name's Chad Worz. I am a long-term care pharmacist by background. Got my degree from the University of Cincinnati. Actually, I have two degrees, a Bachelor's of Science in Pharmacy and a Doctor of Pharmacy. When I came to Alexandria, Virginia, which is where ASCP is headquartered, and ASCP represents pharmacists that work with older adults, typically in skilled nursing and assisted living settings, as well as with older adults in the community. And we're a little different, I think, than a lot of people think about pharmacists. We tend to work on medication regimens and help people get to the right medications for them. So we spend a lot of time with other disciplines like physicians and nurses, trying to make sure that people are on the right medications that work for their lifestyle. And vaccines are a big part of that.
What is the problem with just requesting a flu shot, and what do we know about this year's particular flu season?
Well, I think like anything else, as people age, they become a little bit more sensitive to medications in general. And a lot of the work that our pharmacists do is around making sure that we fit the medication or the therapy to the person. So there's differences in flu vaccine, and people that are older and maybe more vulnerable require a different kind of a flu shot than just the general flu shot that younger people might get. So we spend a lot of time working on making sure that when somebody does recognize that the flu shot is right for them, that we choose the right one for them that gives them the greatest degree of protection.
Why do we need a flu shot each season?
The flu vaccine, or the flu virus itself, is very modifiable. It will evolve. And we know that over years of experience that the flu virus circulates around the globe. And each year we make a prediction. We make a prediction of what we think the likely flu virus is going to be, and we build our flu shots on an annual basis to try to match what we think is going to be the most prevalent virus. This is done on an annual basis, and we know that the flu tends to peak in the winter months. So we build the flu vaccine over the spring into the summer. We deploy it in the early fall, and we ask people to get vaccinated as they approach that winter season so that they have the maximum protection.
How do you best start a conversation with your healthcare provider about the importance of getting the flu vaccine? And are there people who are more at risk? I mean, obviously, if you have a chronic condition, you might be more at risk. But are there any other factors in that older population that would affect the type of flu shot that they get?
Yeah, I mean, it's a good question. I think in some ways, having gone through a pandemic like we've recently gone through, it's really put a bright light on that aspect. We know that older adults, particularly older adults in nursing home settings and assisted living settings, and those with multiple chronic conditions, were the ones that were most affected by COVID-19. That isn't much different than what we look at with the flu. The flu can be something that causes problems in 70 to 85% of individuals over the age of 65. That is where we see the most seasonal flu-related deaths in that population. So we know that they're more vulnerable. And when we're talking to people, that becomes sort of the approach, is to recognize what stage you're in. You're an older adult. Maybe you have diabetes, or you have other issues that may make you more vulnerable or have less of a reserve. And that becomes the rationale for making the choice about which flu vaccine to get and when to get it.
There's a new flu vaccine campaign from your organization as well as Sanofi, encouraging, of course, older adults and those with chronic conditions to speak with their healthcare providers. Tell us a bit more about specific benefits from Sanofi's flu vaccines, Fluzone, high dose, and others.
So the campaign we're working on is called The Season. It's a horror movie themed commercial program that uses sort of a wolf as sort of this risk that's out there with that horror movie theme, and it's really compelling. And I think it tells a good story because it does, sort of reflect what we think of the flu. The flu is sort of out there. We don't know where it is. We don't know when it's coming, but we know that it's out there and it's a risk, and we need to do what we can to prevent that risk from causing problems for us. So it's really designed to engage people in the thought process of, hey, I do need to be thinking about flu. We have just gone through a pandemic. I recognize how important it is to get vaccines to prevent serious illness. And it kind of sets up the conversation that you might have with the healthcare professional about Fluzone high-dose quadrivalent vaccine or Flublok quadrivalent influenza vaccine. The Fluzone high-dose quadrivalent vaccine is the one that is specific for people over the age of 65 and really represents their best opportunity to get the best protection. And that's what we're trying to create with this campaign called The Season.
Explain to us some of the barriers. What was it that was preventing people from getting flu shots? Are there misconceptions about the flu shot, about the process, about the vaccines? What was the problem, or what is the problem with people not getting the flu shot?
I think to some degree it's fatigue. We have to do this every year. We did go through a pandemic, and maybe the silver lining of the pandemic was the creation of some hesitancy around vaccines. So being able to differentiate that, hey, influenza is something that's been around for a while. We've become very good at this process of creating these vaccines, predicting what's going to be beneficial on an annual basis, and getting shots and vaccines out to individuals that need them. So I think it's overcoming a little bit of that hesitancy. The other part of it is just making sure that we can be meeting people where they are, that the vaccines are convenient enough that you can go to a pharmacy and get one, or you might have a vaccine clinic at an event you're going to in the fall. So I think a combination of just being out there and having it available, as well as sort of overcoming some of that hesitancy that we saw from the COVID-19 pandemic, is really, the effort that we're trying to make. So having a campaign that puts it out there in front of everybody, gets the conversation started, and leads them to their healthcare professional where they can have a conversation about what's right for them, is really the emphasis and the priority.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more?
So I think from our perspective in healthcare, we really want individuals to have conversations, to seek out the strategies that are going to provide them the most benefit, and not only for yourself, but for your loved ones. We know that the vulnerable population and people over the age of 65 are the ones most at risk. We now have specific vaccines that are unique to them. The Fluzone high-dose quadrivalent vaccine is specific for people over the age of 65. It adds extra protection from the standpoint that it's a higher dose and elicits a higher immune response. We want people to have that option to get those vaccines and to talk to their healthcare providers about why that's important. In terms of a website to go to get information, SanofiFluShots.com. It'll provide information for individuals that are looking for where to get their flu vaccine, what flu vaccine might be right for them. And it's, again, the beginning of the conversation with your healthcare professional on what flu vaccine is the best one for you.
Chad, I appreciate you joining us here on Health Professional Radio. Hopefully you'll return.
All right. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Chad Worz. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.